Good morning, everybody. It is my pleasure to welcome you to the Kansas City Star's Opioid, Stimulant, and Trauma Forum. This event will focus on exploring the underlying causes of substance abuse disorders, as well as highlighting recovery and prevention strategies to specifically address the harmful abuse of opioids and stimulants. COVID-19 brought with it its own set of problems for those struggling with addiction. Lockdown measures and social distancing orders kept some struggling with addiction related issues away from their coworkers, loved ones, mental health care providers, and others in their support systems. Meanwhile, issues that were still present before the pandemic, such as a rise in fentanyl related overdoses, lack of access to treatment facilities, and unfettered access to prescription opioids and stimulants, still linger. According to the CDC, 13% of Americans reported starting or increasing substance use as a way of coping with the stress related to COVID 19. Perhaps more troubling is the fact that overdoses have spiked roughly 30% since the onset of the pandemic. And it's important to note that the overdose data does not even include the roughly 70,000 alcohol related deaths that the United States experiences annually. Additionally, the St. Louis division of the DEA reported a record number of fentanyl seizures in just the first 3 quarters of this fiscal year. Consequently, there is a renewed urgency among the public to address the nation's addiction epidemic, which leads us to our discussion. Today, we'll center our attention on how to better educate people about the complex disease of the body and brain that is addiction. We'll discuss different ways in which society at large could help reduce the stigma that surrounds addiction and highlight preventative strategies that could be implemented as a means of reducing the number of people who are afflicted with this disease. And finally, we'll talk about the best ways to treat people who are suffering with substance abuse disorders. It is now my honor to introduce our group of panelists. Dr. Douglas Burgess is an addiction medicine specialist who works at the Truman Medical Center's Behavioral Health Recovery Unit. Dr. Burgess has spent years providing evidence-based, high-quality care to those struggling with addiction. Jamie Boyle is the CEO of a residential, nonprofit sober living recovery provider called Welcome House Kansas City. Welcome House is an organization dedicated to supporting and empowering alcohol and drug addicted people to live healthy and productive lives. Pam Greenberg, a retired healthcare consultant, lost her son Justin to an opioid overdose in February of 2015. In the years since suffering that tragic loss, Pam has dedicated her time to helping educate the public about substance abuse disorders. Pam is now the president of Addiction is Real, a nonprofit organization with a mission to provide parents with the tools to take a proactive approach in discussing and recognizing the dangers of substance abuse with their children and their loved ones. Miles Alley is the assistant special agent in charge of the Kansas City District Office of the DEA's St. Louis Division. His responsibilities include overseeing DEA offices and activities in the Western District of Missouri. Alley has worked for the DEA since 2003, and he was assigned to his current position in May of 2021. We encourage our audience to participate in the discussion by submitting your questions through our Facebook comment section. We are now going to open our forum. Dr. Burgess, in an article titled "America Has a Drinking Problem," Kate Julian of The Atlantic suggested that our country is in the midst of an alcohol and drug bender. Do you agree with her assessment, specifically as it pertains to Western Missouri? What has your over decade plus experience in a clinical setting taught you about this?
Yeah, thanks, Max. Yeah, we have definitely seen an increase in the number of people seeking treatment. One of the things that when we're engaging people in recovery, one of the things that we work on a lot is getting them reconnected, because addiction tends to be a disease of isolation. And as it progresses, people get more and more isolated from their family, coworkers. They carry the shame and stigma of substance use, and so they isolate themselves. And one thing that this epidemic has sort of thrust upon us is this need for isolation at times, the need to separate ourselves from friends and family in order to keep people safe. And so that, from my perspective, has really contributed to some of the increases that we've seen, particularly around alcohol use, opioids, and different drugs that we see. So definitely we've seen an increase.
Thank you. So you talked about the stigma that's related to addiction. I wanted to try to lessen the stigma in our discussion. Could everyone who has suffered from a substance abuse disorder or who has a family member who has suffered from a substance abuse disorder, please raise their hand? See, that's everyone. So Pam and Jamie, first Pam, what is one thing that you learned during your son's treatment process that you wish you knew before starting on the road to recovery? I'm sorry, Pam, you're muted.
Thanks, Max. So what I wish I knew is what I am now teaching parents. There was nothing like Addiction is Real around when my son was in high school and college. And I honestly was so naive that I didn't know what to look for. I wish I had known. I wish I had taken steps earlier to help him. If I had known, I would have. And I think by the time myself, my husband, and our entire family found out that Justin was struggling, it was too late. He was already an addict. And once an addict, that's a whole different ball game from your kids starting to try drugs and try alcohol, all of that experimentation. But once it gets to an addiction, you've got a whole nother hell to live through.
So staying with you, Pam, what are some things that parents or loved ones could look for if they think that their loved one is suffering from a substance abuse disorder? What are some of the telltale signs?
Well, first of all, you have to really know your children and you have to be involved in their lives, because what you'll look for is a change in a group of friends. All of a sudden, they're hanging out with people you don't know or you know they shouldn't be hanging around with, that they start to remove themselves from the family unit. They were always part of the after dinner get together and the talk of the day, but now they're up in their room. Sort of no regard for siblings or parents when they hurt their feelings. All of a sudden, they don't really care. A change in hygiene, a change in their behaviors as far as not coming home at curfew. All these changes, which the tricky thing is that this can be attributed to being a teenager. But if you know your children, you know when it's a dangerous slope. And the early intervention is what is required at this point.
Thank you, Pam. Jamie, I want to ask you, what do you think could be done to lessen the stigma that surrounds addiction? I'm sure that you have a lot of patients that come in who are really embarrassed by what they're going through.
Yeah, it's a great question. And I think, everyone will benefit from a reduction in the stigma and any guilt or shame associated with alcoholism and addiction. I mean, the question you posed to the group around, raise your hand if anyone has personally or knows or been impacted. I mean, that's the answer right there. But, for so long in this country and socially, I'm in long-term recovery. I've been sober almost 10 years and I struggled all the way back to my teenage years. And I've used the story before. I don't really think my dad was at the water cooler talking about his teenage son who was an addict and struggling with drugs and alcohol. And that's unfortunate because when you don't feel comfortable because of the stigma that's associated with it, whether or not, you don't want to shine your child in a bad light or depict them in a way that would be damaging to their future, or if you were just embarrassed or feel like if for some reason it's your fault as a parent. When we don't talk about it, when we don't provide access to resources and tools and education, and really just accept it as the disease that it is, not unlike other diseases that, folks are afflicted by or impacted by or have to deal with in their life, then it just sort of stays in this dark corner, and people suffer needlessly. And the reality of it is that recovery is possible, and somebody with substance use disorder can go on to live a meaningful and purposeful life. And there are things that they have to do to be able to have a life like that. But it's very, very possible. And so to confront that, I think a forum just like this, the more that we can all get out in the open and start talking about it, talking about our personal experiences, talking about the impact to our lives, to the broader community as a whole, the more it's out in the light, the better we will all be in dealing with it and addressing it.
Thank you, Jamie. Pam, you wanted to add to Jamie's comments?
Yeah, because that really struck home, Jamie. When we first discovered Justin had an issue, it was something we didn't talk about. I did not want my friends and family to have this, to have a reputation for Justin when he snapped out of it. Okay, so I still had, I still was so naive. I hadn't learned everything that I certainly know now, but we didn't have anyone to lean on but each other then. And so when I did start talking about it, the floodgates of help opened up, and you learned that there were people in your shoes that you could help, and that just by having that discussion and finding out resources was invaluable. So sharing the story was so helpful to us.
Thank you, Pam. I now want to throw it to Agent Allie. One of the biggest problems that our country is facing right now in terms of the addiction epidemic is the prevalence of fentanyl. I wanted to ask you, how has your organization been dealing with the amount of fentanyl that's been flooding the streets, and how can we stop fentanyl from entering our streets and being used by addicts right now?
That's a good question, Max. As you mentioned at the beginning of the show, the DEA has seen record-breaking levels of fentanyl seizures, which indicates that not only has the amount of fentanyl flowing into the country increased, but that our focus on those types of investigations has increased as we try to stem that tide. I think historically we've seen that enforcement and arresting our way out of the problem is not going to end the drug epidemics we see. We're a partner with the other elements that are trying to address and organizations that are trying to address the problem. We do everything we can to focus on the biggest offenders, the most violent people, the people engaged in bringing and selling these dangerous substances in our country. These people don't care about the damage that they're causing. They're driven by greed and by personal gain and wealth and power. And they'll, as long as there is a market to exploit, they'll continue to find ways to exploit that market. We're using every resource available to us in partnership with local and state law enforcement agencies and other federal agencies to identify these people and prosecute them and dismantle their organizations.
Thank you, Agent Allie. Agent Allie talked about how we're not going to arrest our way out of this problem. Jamie, I wanted to ask you, other than throwing people into the criminal justice system, what other ways can governments deal with addicts who have arrests on their record or do need to have some type of government intervention?
Well, yeah, I mean, that's a big question. And I think we're seeing some of those ways, in drug courts and in the legalization arguments and policies and positions. I can speak probably more specifically to my own experience and the folks that we see at Welcome House on a regular basis. these are folks that have used drugs and alcohol for extended periods of time, and they're by no means experimental users, so the process for them to find sobriety and then long-term recovery, build a foundation in long-term recovery, it takes a while. I mean, this is not something that happens overnight or in a week or a 28-day program. I mean, we're talking about structured rehabilitative supports and tools and things, and it really is based on the premise that that's what the person wants, and I think that that's an important distinction. If somebody is struggling in their life and they come to Welcome House and they've got extensive drug and alcohol use history, and like most alcoholics and addicts, they've had brushes with the law and problems in their life associated to their use. If that person doesn't want to heal, if they don't want recovery, and surprisingly and unfortunately, there are those that don't want it, and I think that becomes the challenge. How do you separate somebody who's genuine and willing and really needs to be supported and given opportunities to change their life from those that don't? I think all of the things right now that are being tried are worthy attempts. What's the right answer in that space? I really don't know, but our experience has been, the longer we can stay engaged with somebody and help them, provide them with the tools, counsel them on how to live life on life's terms. Again, somebody who really wants that and wants to change their life, the longer we can be with somebody, the more likely we are to be successful.
Thank you. So, Dr. Burgess, just this morning, the Purdue Pharma's Sackler family threatened to withdraw their pledge to pay $4.5 billion to communities that have been devastated by the opioid pandemic. The settlement funds were intended to help cover the extraordinary cost of the addiction crisis. Can you help me understand the financial burden that the opioid epidemic has placed on communities across the country and just the strain that it's put on our healthcare system?
Yeah, it's when you talk about the costs, it's really, for me, it's hard to even grasp what an impact it's had. I can talk about how much the medicines cost. I can talk how much it costs to go and see a physician, and those numbers are are high. But I think that the costs that are much more difficult to calculate are the costs related to the damage it does to families, and the impact it can, and I want to be clear here, not everyone who has a substance use disorder is a criminal or is going to necessarily have a run-in with the law, but if you look at you're much more likely to have that occur. And so the costs in terms of the legal system, it's just almost insurmountable. And so when you hear that number thrown around, $5.4 billion, it seems like a big number, but when you spread that across the country and you think about the number of people that this impacts, that number isn't close to compensating for how much damage there is and how much this is going to cost.
In what ways do you think that prohibition has fueled the troubling rise in addiction across the country, Dr. Burgess?
Yeah, this is a really difficult one because we know that the more access people have to particular substances, the more likely they are to use those. So if there's more opioids in a community, if there's more prescriptions of opioids, then you're more likely to get people who have, due to a number of reasons, genetics, lifestyle factors, all these different things, are more likely to develop an addiction. At the same time, we know that if you cut back on things and you don't have a plan for how to manage the fallout from that, then you're going to have issues. So if you have someone who's maybe at risk for worsening of an opioid use disorder, for example, and you sort of just in this draconian manner shut down the number of opioid prescriptions, a percentage of those people are going to be forced to the streets to buy things from the street. And then when you cut off the supply in the streets, then people have a tendency to turn to heroin. And as heroin gets cut down, then we've seen them turn to fentanyl, which is much more potent, and it's easier to, it's easier to sneak it into areas. I mean, it was a few years ago, but in Kansas City, they found someone at a bus station who had in a bag with them enough fentanyl to kill like 2 million people or something, and it was in one bag. And so this progression that we see as we sort of try to clamp down on this, without offering treatment for people, we're in some ways making the problem worse.
Thank you. You talked about fentanyl. Dr. Miles, I wanted to ask you, how have DEA agents been able to test drugs for fentanyl? Like, are they running into problems with basic stop-ins and having to wear a lot of protective equipment? I've heard from a couple of people in law enforcement that because of the potency of fentanyl, it's just a very hard drug to get off the streets.
Yeah, there's several interesting issues raised there. And fentanyl is a very dangerous substance. The dosage units are in milligrams. It's something we have to take a lot of precautions with handling it. We've changed our policies on how we field test drugs across the board, because we're finding every drug that we come in contact with in some instances has been contaminated with fentanyl, everything from marijuana to pills to unknown powders. And so we no longer do the quick field test on the street to see what it is. It's all got to be processed in a controlled environment with fume hoods and personal protective equipment and more expensive testing equipment that doesn't expose our agents to contact with these substances.
Has that also impacted the way that agents administer Narcan? Is there a hesitancy for enforcement agents to go up and administer Narcan to someone that they think might be possessing fentanyl for fear of them coming in contact with the drug?
No, I don't think that's happened. Our agency's goal is to keep our communities safe and healthy. And the men and women of DEA are very committed to that mission. They're people who are drawn to this field because they want to protect people. They want to make a difference. And so we hear stories daily of, there was one in Arkansas just in the last week or two where an agent was out on surveillance watching a suspected fentanyl distributor and saw someone that he thought had been involved in illegal purchase fall on the ground and appear to lose consciousness. And he left his surveillance post and responded to that and treated that person with Narcan and saved their life. It's as Dr. Burgess mentioned, it's a horrible drug. It's easier to move. It's more potent. It's 50 times more potent than heroin and 500 times more potent than morphine. And so a kilogram of it goes a lot farther. The dangers associated with that is that it's so potent, it's very hard for a lab that's not pharmaceutical grade to get the dosage levels right. And so those counterfeit pills that we're running into are an incredible danger to the community. You're really playing Russian roulette when you take or buy a pill that didn't come from a pharmacy, wasn't prescribed by a doctor. You don't have any idea what's in that pill. DEA has seen in the last year, 1 in 4 of our pills that we submit, counterfeit pills to the lab, have a lethal dose. It's just horrible odds.
In respect to Narcan, which is a drug that reverses the effects of an opioid overdose, are most law enforcement units across Kansas and Missouri now required to carry Narcan? I ask you, Agent Alley, first, and anyone else if you know the answer.
I don't know that it's required. It's it's something that's available to our agents, and we have it for the protection of our agents. And of course, they would utilize that if they were to come in contact with a person they suspected needed it to save their life.
I want to open this question up to everyone. What is some low-hanging fruit in terms of policy initiatives that lawmakers could introduce in order to lower overdose rates and increase access to addiction recovery services? So the first thing that I was thinking of was the needle sharing places, like safe consumption sites. Does anyone else have any like low-hanging fruit policy initiatives that they would like to see either Kansas or Missouri or the country implement?
Well, I can comment a little bit on that from the healthcare perspective. Some of the low-hanging fruit would be just increased coordination among agencies. It's long term. I think we need to invest more in the overall infrastructure that we have to treat people with substance use disorders. A lot of I know where I work here, sometimes we are reliant on grant funding. I imagine, Jamie, you guys probably rely on grant funding. I know you fundraising, things like that. And so when you have this sort of piecemeal treatment of a very complex disease, it makes it difficult to coordinate care, and there's a lot of redundancy. And we also know that patients at times move from place to place due to housing insecurity, and so every time that happens, there's a potential to disrupt care, particularly when we can't communicate and coordinate. So I think that's kind of an early thing we can do as a community, is just build these relationships so that we can all be pulling in the same direction.
Anyone else have any ideas? Pam? You're on mute. I'm sorry.
Oh.
Now you're good.
Okay. I'd like to talk about a bill that has already been passed in Missouri, but I don't believe enough people know about, and that is the Good Samaritan bill. And what that means is that if you are with someone who is using drugs, and you might be as well, if they drop, if they pass out, if they overdose, you can call 911, and when they come, you will not be arrested, you won't be charged. It was in the paper when it passed, and I think a lot of adults do know about this, but it's something adults need to talk to their kids about, because they're the ones who will be at a party when a friend of theirs drops. And if they are too afraid to call, that person could die. I actually believe this is what happened to my son, is the guy who was with him was just too afraid to call for help, and he passed away just in front of this guy.
Thank you so much for sharing that. I do think that states that have implemented laws like that have seen success in at least lowering some of the rates of overdose.
Mm-hmm.
Could I comment on that, Max?
Yes, of course.
I think there's an impression in the public that law enforcement is out looking for users and is persecuting them, if you will. And it's really never been federal law enforcement's focus, DEA's focus, to focus on users. We're trying to identify the organizations and the people that are responsible for these distribution networks that are, the worst of the worst. And law enforcement across the country is shorthanded for a very variety of reasons, and narcotics units in particular tend to be shorthanded, and they are focusing their limited resources on the worst problems in their community. And while we're in a difficult position as law enforcement when it comes to dealing with addicts who are possessors of banned substances, it's our intention is always to focus on the people who are profiting from this sickness and this disease, to deal with those greedy, evil people, if you will, who are damaging our community so much.
Thank you, Agent Alley.
Max, I'm sorry, just two other quick things that I think are low-hanging fruit that I think I really are important to get across. Narcan, if you have a family member who has an opioid use disorder that you know about, Narcan, you should have that. It should be like a fire extinguisher in every home. You're not going to hurt anybody by administering Narcan if you think they've had an overdose, even if they haven't. So I think that's one thing. And then the other thing that I would point out for families who are listening, if you look at where the majority of people who start using opioids in particular, where they're getting those opioids, it's not from a drug dealer on the street, it's from your medicine cabinet. Yeah. So looking in your medicine cabinet, and just when you have those old prescriptions that you got from a dentist or primary care when you had your knee surgery or whatever, when that you don't need those, we should be getting those out of the drug cabinets, because that's where many people initiate use.
Thank you. So you're so right that most people who are getting into or starting a habit are going right to the medicine cabinet. And I do think that some of these pharmaceutical companies are going to be held accountable. Just last month, we learned that Missouri and Kansas are expected to receive hundreds of millions of dollars in the coming years after signing on to a nationwide settlement with a couple of opioid companies and distributors, including Johnson & Johnson. I was wondering if you guys had any suggestions on how we can ensure that settlement funds go directly to the state. And Dr. Burgess, you might be able to weigh in on this. Oh, and Jamie and Pam, how do we make sure that organizations like yours are able to apply for grants and get that money directly? What problems do you guys currently run into when you're applying for grants? I open it up to you.
Is a lot of competition. And companies and people who provide those grants are inundated with requests. As we continue to apply for grants, and we fundraise, we do everything we can to bring money in so that we can reach more parents to educate them. But I just think if there were a central way to propose what we would use the money for and make the process easier for organizations like ours, that would be a great help.
Anyone else?
Well, I do think that with the the spotlight that's been shined on addiction, in large part due to the opioid epidemic, because when you have sort of young, healthy people, dying without much warning, there's been a lot of attention on this, and I do think there's been an increase in the amount of funds that are available. But I think from a policy perspective, I mean, it's really crazy to think that we are treating something that is so prevalent in the community. I mean, 1 in 10 Americans over the age of 12 years old it's estimated that 1 in 10 Americans over the age of 12 will suffer from a substance use disorder at some point in their life. And the fact that we have to rely on grants to treat this, to me, is part of the problem, because it's so piecemeal. It's not easy to coordinate. And, I imagine for people listening, if you needed dialysis, I imagine most people could tell you where they would go for that. But I imagine most people on this call wouldn't be able to tell you where they would go if they had a family member or a personal issue with a substance use disorder. So I think, the grant funding is a piece of it, but really as a society, I think we need to be moving more towards parity in terms of how we treat substance use disorders and mental health issues for for the same reason. We shouldn't have to rely on grants to treat this.
Thank you. Jamie, did you have something to add?
Well, yeah, I mean, I just want to agree, streamlining the process and, basically pulling out roadblocks and red tape and all of the stuff that those of us who apply for grants and rely on grants for funding have to deal with on a regular basis. That's a complicated and challenging space to navigate. And, you build your programs and your resourcing and your interventions relying on those things. And then, you create a process where you've got to stay in that game and continue to sort of drive those funds and, re-up, if you will. And so, anything that would help us to make that process more efficient and reliable, I think would be fantastic. And I don't know exactly what that is. Welcome House doesn't seek or utilize state or federal funding on a regular basis, and that's just a decision that Welcome House has made. And but the grant process, while incredibly important and invaluable in some ways to what we can offer as a program, it's just a challenge. And back to the fentanyl thing and the opioid issue and money from the pharmaceutical companies. At Welcome House, we've had opiate users since since the founding of our organization 50 years ago, and even today. While the addict component or drug-related component of our overall population is much higher than I think it probably was in the early 70s, for us, 80% of the guys that we see, are either self-identifying as addict only or addict and alcoholic. So the majority of our population, opiates are really, like number 6 or 7 on the list when it comes to, what we see guys relapsing on, or what guys are testing positive for in UAs, or even as identified drugs of choice. So there's significant issues. And of course, we would love funding associated with opiates, but, the comment and point that was made earlier that we just sort of glossed over, and really haven't addressed, is that fentanyl is being used in all substances. I've got an 18-year-old daughter and a 20-year-old daughter, both in college, and my kids have known kids that have OD'd and died with, based on the counterfeit pills that were loaded with fentanyl in an unscientific, unregulated process to create those pills. And the other issue that I think that's really challenging, and I don't really know how you get around this, or how this is addressed, but the use of social media and all of these communication platforms. A kid today can pretty much find anything they want in any location of this country at any time. And that's a scary thing. That for me, when I was using very active in my addiction and disease, that wasn't the case. So the fact that fentanyl or opiates are used in just about anything potentially nowadays that a kid might be interested in or exposed to as a young person in an experimental type setting, for example, that's scary. And then on top of that, the fact that, that smartphone that they got for Christmas is connecting them to all of that. And I don't know how I don't know how that's regulated, or managed. So what we're seeing, Max, at Welcome House, what we're seeing, and we had a conversation about this, you and I, what we're seeing is clusters of overdoses, in ways that we didn't see before. It was very common in the recovery rooms, to hear about, somebody that you've known in long-term recovery or struggling, dying, from suicide or relapse or overdose. And, now we're seeing those things happen in 4s or 5s at a time, which is, that, and it's incredibly troubling and it's sad, but they're also often related to opioids and specifically fentanyl, experienced significant, heavy, whatever terminology you want to use, drug users that are going out and mixing something up, and, they don't know what they don't know what they've got. And it's one shot and they're dead.
So on the topic of overdoses, one of our audience members, Jeremiah, works at a nonprofit treatment center, and he says that we have Narcan available for the community. I was wondering where the average person could get Narcan. Do you have to go through some type of training? How could we help people understand where to get Narcan?
So Narcan is available at any pharmacy. You actually don't need a prescription for it in the state of Missouri. There was a standing prescription that was distributed to all pharmacies so that you can go to any pharmacy and request and it's available. In terms of training, there are statewide trainings that are done, but I think it's more important it's pretty self-explanatory how the medicine works. If you think there's someone who's had an overdose from an opioid, which that looks like you may not be able to arouse them, their lips may be blue, they may not be breathing, or they might be taking shallow breaths or snoring. Those sorts of those are signs and symptoms that someone may have had an overdose. And there's two forms of Narcan. One is a shot that you would put in their leg or their arm, and the other is a nasal spray. And so on the package, when you look at it, it's very self-explanatory, that, I mean, I think that's a great place to start. If you have a family member or someone who's high risk of having an overdose, even if they don't have an addiction, even if they're just on high doses of prescription opioids for whatever reason, this should really be something that every person who should have access to.
Before we end, I wanted to talk about medical assisted therapies. Over the last decade, there has been a shift in the treatment world towards more medical assistance when you're going through substance abuse treatment, whether that be a Vivitrol shot, naltrexone, or for alcoholics, drugs that make it impossible to secrete the enzymes that metabolize alcohol. I was wondering how your organizations are trying to either teach parents or kids about medical assisted therapies, or how your organization is implementing such treatments. Pam, do you?
Well, what we are telling parents is that this problem is rampant in their homes. The kids who are going to school are hearing about kids who feel so good, and how they felt stress relief when they smoked a joint. And one of the things that is hard for a parent to understand is that the average age of a child who starts to experiment is 11 to 12 years old with alcohol, and the average age for a kid who starts with marijuana is 13 years old. These are little kids, and like was said earlier, they're starting out in your medicine cabinet. They know dad had back surgery. They hear that pill can make them feel great. They start with that. Then they get addicted. And that's when they go to the streets to get more. When they run out of what's at home, they might go to grandma's and their friend's house. But it can be more than your family. I mean, it could be the cleaning lady. It can be the repairman. It can be anybody. If an addict walks into your house, they know where to look. And that's the real importance of getting rid of those drugs when you're not using them anymore. And if you are still using them, lock them up.
Agent Alley, did you have anything to add on the medicine cabinet subject?
Just to agree with what Dr. Burgess said, that is a common problem. DEA spends resources twice a year to host what we call the Take Back Day, where agents and employees go out and assist the community in disposing of those medicines. But that can be done year round. There's collection sites in every community, and it's very important to dispose of those medications before they fall into the wrong hands and wind up poisoning someone you love.
Thank you. So it's just about time for us to wrap up. Do any of you guys have anything that you would like to share before we wrap this up? Any final comments? I'll start with you, Dr. Burgess. You're muted. I'm sorry.
Thank you.
There we go.
Okay. Thanks so much that's like the tag phrase of the COVID epidemic. So thank you so much for hosting this. I think you talked in the beginning about stigma, and things like this are the beginning to reducing stigma. The more people understand about addiction, the more people understand that it's a disease, the better off we're going to be in sort of this gradual process of reducing stigma. The other thing that I want to emphasize, we didn't get to touch on it a lot today, but at the end, many people don't realize that there are medications that are available that can help. Now, I'm not saying medication is the only thing that they need, but many people are surprised when they hear that, oh, there's medicine to help people cut down on their cravings for alcohol, or there's medicines to treat opioid addiction. And so that conversation just starts by talking to your doctor, or talking to a healthcare professional. The earlier we can intervene, the better it's going to be. So keeping this a secret until it becomes so unmanageable that it starts to destroy people's lives, there's hope for those people as well. It's just the road is much more challenging. So those would be my closing thoughts, and thank you.
Thank you, Dr. Burgess. Jamie, any final comments?
Sure. Yeah. And I want to echo Doug's comments about the event, and thank you as well. And for including me, really recovery, the message that I want to send and the message that we send to the guys that come to Welcome House is that you're strong enough and you're not alone, and recovery is possible. And, we are, by our origin, a 12-step based program. I mean, that's the program that I've used in my personal life to find sobriety and long-term recovery. I'm grateful that, I don't have to take a pill or anything to maintain my sobriety. There's other things that I have to do. But we also have a medication-assisted treatment component of our program at Welcome House. And, there's a subset of guys that are there. And again, to Doug's point, there are a lot of options. And if you look at it from the perspective of recovery is possible, just get out there and talk to people. And, medication assisted treatment may not seem like it jives with a 12-step program, for example, but, you can't really teach the 12-step program to somebody who's dead. And, medication assisted treatment can help facilitate that process. And so, there's just a lot of options out there today for people for support and help. And I just encourage people to do that.
Thank you, Jamie. Pam, any closing words for us, please?
Yeah, our focus when we talk to parents is really to get them to start talking to their children early. And we recommend that they start even in preschool. If you go to our website, www.addictionisreal.org, we have lots of tips on how to talk to your kids. So a preschooler, you would talk about trusting mommy and daddy. And when you don't feel well or you're uncomfortable with the situation, you bring that to mom and dad, and that you don't ever share medicines with friends. And as the child gets older, you introduce different topics into that. We have lots of tips for that on our website. But also the naivety of parents. They need to wake up. They need to educate themselves. They need to know what the current trends are. And as I always finish my presentation in front of a group of parents, I tell them that the 3 most dangerous words that a parent can say is "not my child."
Thank you, Pam. And Agent Alley?
Thank you so much, Max, and to the Star for hosting this terrific message. And thank you to everyone who's participated. And thank you for including me. To quote the late great, or paraphrase the late great Mr. Rogers, the DEA agent and the law enforcement person in general are members of your community, and we're dedicated to protecting the community and keeping it safe. Our goal is to help, and we're constantly learning and finding new ways to do that. And this partnership of everyone in the community coming together to find a way through this is very important.
Thank you so much. I would like to thank you all for participating in the STAR's Opioid, Stimulant, and Trauma Forum. I'd like to give a special thank you to our panelists for taking the time to help us navigate this complex issue. I would like to encourage you all watching at home to subscribe to the STAR and gain access to our award-winning journalism, including our coverage of the addiction epidemic. With that, I bid adieu, peace and love, and bye for now.